Across the country, gatherings like this one take place every day. But this is not a regular visit from a girlfriend. This mother is participating in a home visiting program in San Diego, California. Gabriela Talamantes is a former preschool teacher and child development specialist.
I see her as being everything to me. I see her as a friend. I see her as a teacher. I see her as a guide.
As a home visitor, Ms. Talamantes has been guiding and providing resources for this mother of four since her youngest was an infant. What's different about this meeting, though, is the client doesn't come to her. She goes to the client.
I feel very grateful that they opened the doors for me, because they received me in their house, and after 3 years, I'm like a part of the family. I realized that you can make a huge difference in the family's life when you go to their house and you understand their needs. You realize how you can support the families and how you can help them to be successful in this country.
In March of 2020, researchers at Child Trends began investigating the complex California home visiting landscape. There are hundreds of programs all over the state, run by different agencies with different funding streams and no database to bring all that information together. The researchers developed this mapping tool. By clicking on a specific county, stakeholders can now gather a wealth of information.
They can look up things about like how many slots are funded for each of those programs and how many staff do they have. We also have information in there about the types of families or characteristics of families served.
With the pandemic in full swing, home visitors took their work out of the homes and to the computer screens via video conference.
One morning, Henry gets up.
Just 1.5 hours north of San Diego in San Bernardino, Alma Mendez was helping her sister-in-law care for 3 young children. The home visitor helped her weather the pandemic storm.
During those times, so challenging times. So even there, it helped us in ways on how to how should I say, just to regulate, and with stress and the fact of being at home for so long, and especially with the kids.
These were challenging times for the workforce too. Researchers wanted to know how they were navigating the pandemic.
So we kind of pivoted the study to both kind of examine what was going on with the home visitors and how they were able to continue to meet families' needs, both in the middle of this public health crisis.
They found a workforce under duress due to the pandemic, experiencing high rates of stress and challenges with their position, because a large portion of the workforce was new to home visiting. And the chief deputy director of First 5 California, who funded the study, immediately recognized that home visitors needed support.
What struck me was hearing their voices saying that it's hard, it's heavy, right? Especially when a system is uncoordinated, right? When they don't feel that their voices are heard.
These are just some of the recommendations. To address the high rates of stress, develop a pipeline for recruitment, skill development, and career advancement, and provide salaries that reflect a local living wage rate. Increase awareness of home visiting as a profession. To support home visitors working with families facing challenges, prioritize the mental health of the workforce. To understand the full picture of services to families, create integrated data systems.
One of the hardest recommendations to implement is data sharing. If we can do it, and I know the state is investing in the Cradle to Career data system, that's going to take a while. I think that would be a critical piece, but also definitely one of the most challenging pieces to navigate.
Studies have shown that home visiting programs lead to improved maternal and child health and to the adoption of positive parenting practices and greater school readiness. And there is a potential cost savings for health care and welfare services too. But these parents and caregivers don't need data to be convinced that the program is a life changer.
you start like getting new tools, you know, that you didn't know before, showing the parent, in this case, like my sister-in-law, and then myself, that I'm like very involved with the kids, you know, like just how to breathe through it, you know, patience.
La señora Gaby me ha enseñado a...
Miss Gabby has taught me how to handle her tantrums, how not to yell at them, and instead talk to them. This is great advice. Advice that I would have liked to have had with my 3 older children.
My job is to empower them.
In order to help California move forward with home visiting, First 5 California is focusing on the strengths of the state's varied home visiting programs, seeking to ensure that these programs continue to help the workforce thrive too.
Like, I'm a true believer, and we need to do something different because this is such an invaluable service and resource, and we have such an opportunity to transform the healthcare system through home visiting programs, the child welfare system, the CalWORK, so many different systems.
California is in a place where they are really growing their field of home visiting. They want more of these services available, but they're working in a system that isn't very cohesive yet in terms of the workforce. They have varied backgrounds, a lot of different types of training. And so this idea of really bringing them together as a cohesive workforce and just defining what home visiting is in California is such an important first step for the state to be able to then kind of progress forward.
Bye, Gabby.